Alright, I'm going to just discuss how I put my concept maps together. I'll start with sodium. The normal values are 135 to 145. Hypernatremia is an elevated sodium level causing lab values to increase. Anything that is greater than 145. Your hyponatremia is a decreased sodium level that causes lab values to decrease. Anything below the 135. Hypernatremia, those that are in risk are those that have uncontrolled diabetes, consume too much sodium, excessive water loss, impaired consciousness. Some of the signs and symptoms could be agitation, seizures, hypotension, weight loss, intense thirst, and coma. During an assessment, you can do daily weight, monitor vital signs, check the skin integrity, monitor your input and output, check for seizures, check for agitation, and ask the patient about their thirst level. Some interventions that may come in place for hypernatremia is low sodium diet, diuretics, and push fluid, and always educate the patient on water intake and healthy sodium intake. Hyponatremia, those that are in risk are those that have excessive diarrhea, vomiting, taking diuretics, renal failure, or those that are on a fasting diet. Some of the signs and symptoms would be irritability, seizures, confusion, hypotension, dizziness, and clammy skin. For assessment, monitor vital signs, monitor intake and outtake, monitor daily weight, assess skin, monitor for vomiting, diarrhea, nausea, assess behavior changes. Some interventions that could take place are fluid restriction, prescribed medication, or IV, monitor sodium levels, and educate patient on body need for food and sodium on a fasting diet. For calcium, the normal levels are going to be 8.6 to 10.2. Hypercalcemia will, when you raise above that 10.2, and hypocalcemia when you drop below the 8.6. Those that are at risk for hypercalcemia are prolonged immobility, overdosed on vitamin D, have acidosis. Some of the signs and symptoms will be weakness, confusion, psychosis, anorexia, bone pain, dehydration, coma, nausea, and vomiting. With hypocalcemia, those that are at risk have chronic kidney disease, vitamin D deficiency, and chronic alcoholism. Some of your signs and symptoms will be fatigue, muscle cramps, depression, anxiety, seizures, and confusion. Then with potassium, normal levels are going to be 3.5 to 5.0. For hyperkalemia, those that are at risk are renal failure, massive cell destruction, or taking potassium diuretics. Some of the signs and symptoms are going to be irritability, anxiety, diarrhea, cardiac arrest, irregular pulse, and weakness. For the hypo side of it, those that are at risk are with GI losses, fasting diet, renal losses, and those that are on dialysis. Some signs and symptoms for the hypo side will be fatigue, weak pulse, muscle weakness, hyperglycemia, nausea, and vomiting. Next will be the magnesium. Normal values are going to be 1.5 to 2.5. Hypermagnesium, those that are at risk are renal failure, taking excess magnesium. Some signs and symptoms are going to be lethargic, nausea, and vomiting, respiratory arrest, and cardiac arrest. For hypomagnesemia, those that are at risk, suffer from nausea and vomiting, chronic alcoholism, impaired GI absorption, large urine output, and poor controlled diabetes. Some of the signs and symptoms are going to be confusion, tremors, and seizures. Then for phosphate, your normal values are going to be 2.4 to 4.4. On the hyper side of it, those that are at risk are those that have renal failure, excessive amounts of vitamin D, or are taking chemotherapeutic agents. The signs and symptoms are going to be muscle problems, deposition of calcium. And then on the hypo side of it, those that are at risk are those that are malnutritioned, um, alcohol withdrawal. Some of the signs and symptoms are going to be CNS dysfunction, muscle weakness, and dysrhythmias. And that is it.